Giving the bedpan skill. First, I will have made sure that I have all my supplies to bring into the patient's room. I'm just going to explain what I have here: the bedpan, the trash bag. When I come into the room, I'll place that on the end of the bed. I don't want that on the patient's side table or anything. I have a waterproof pad, a towel, gloves, and then I want to have a washcloth, toilet paper, and wet wipes for the patient as well. So I will start by knocking, identifying and greeting the resident. I will explain the procedure to the resident. Then I'm going to provide for privacy by pulling the curtain, and then I will perform hand hygiene. So get situated, set all my supplies out. I will start by raising the side rails, go to the other side, raise the side rail, come back around, and then I'm going to raise the bed up to a good working height for me, which is waist level here. I'm going to make sure that the patient is in a supine position. So if I need to adjust the bed, I would go ahead and do that. And then I'm going to lower the side rail because I'm going to be working on this side of the bed. Now I'm going to put on clean gloves. And I'm going to be placing the waterproof pad. If I needed a bath blanket for the patient, I would have brought that in as well. Okay. I'm going to assist the patient in rolling over to her side so I can place this waterproof pad. Move her back over here. Rolling the patient over if needed. Making sure that that waterproof pad is in place. Now I'm going to be rolling her to her side to place the bedpan. So I'm going to make sure this bedpan is centered appropriately, and I'm going to help her roll to her side. I'm going to place the bedpan firmly down, pressing against the bed so that it doesn't slip out. Whenever she rolls back over, it is centered on her buttocks here, and then I'm going to have her roll over the pan. I'm going to remove my gloves, discard of my gloves in the trash. I'm going to raise the bed up into a sitting position so that she is comfortable. So once I've raised her up in the sitting position, then I'm going to go ahead and raise the side rail here. I'm going to lower the bed all the way down into this to the floor. And I'm going to lower the side rails, and then I'm going to make sure that her call light is within reach. And I'll let her know that if she needs assistance while I'm out of the room, to go ahead and press the call light so that I can come in and assist her. I will also have put her washcloth, toilet paper, and her wet wipes over here near her. That way she can provide her own care if she can. Call light's within reach, the bed is in the proper position, down on the ground in sitting position. And now I have let her know to let me know whenever she's done using her bedpan here, just to hit the call light. So now, and then I'm going to perform hand hygiene before I leave the room. I'm going to close the door on my way out. So my patient has hit her call light. She is ready for me to come back in and remove the bedpan. First, I'll start by performing hand hygiene. I'm going to raise the bed rails on each side, raise the bed rail, come back around, and then I'm going to raise the bed to a proper working position for me, which is waist height, to allow for proper body mechanics. Then I'm going to remove this call light over here. So I'm going to let the side rail down over here, and I'll make sure that she is back in supine position. After I've done that, I'm going to put my gloves on. I'm going to be removing the bedpan. So I'm going to go ahead and have her roll to her side. I'm going to make sure that I grab this bedpan firmly, assist her in rolling to the side, remove the bedpan, put it at the end of the bed. I'm going to cover that bedpan with a towel. And then if she needed any perineal care, after I roll her back over, I'm going to go ahead and wiping front to back, provide for any kind of perineal care that she may need, discard of the waste in the trash bag. Once I've provided for perineal care, then I'm going to go ahead and roll her over. I'm going to remove the waterproof pad, making sure I'm rolling that away, not getting anything else dirty. Okay. Then I'm going to dispose of the waterproof pad and the dirty linens bag. I'm going to remove my gloves, those in the trash, and make sure that she is covered and comfortable. And then I can go ahead and raise her back into the sitting position if she'd like to be positioned that way. I'm going to raise the side rails. Then I'm going to lower her bed. I would perform hand hygiene as well. Make sure her collar's within reach. Put on a new pair of gloves. She's comfortable. She's all the way down to the ground. I have lowered her side rails and everything, made sure she's in her proper position with her bed there, collar's within reach. I've put on new gloves. I'm going to take her bedpan and I'm going to take this to the bathroom. I'll record any output, especially if she is on input and output. So I'm going to record that. And then I'm going to clean the bedpan appropriately according to the manufacturer standards as well as the facility standards. I'll dispose of everything properly, remove my gloves, dispose of my gloves in the trash, and then I will perform hand hygiene. I'm going to report and record, and then my skill is complete.